I think that I like to use things off-label a lot. I think that once something is actually FDA approved, it's kind of old news to me. So that's why you'll always hear talks from me that are mostly things that are off-label. I feel like the bra line is a real problem spot for most women. But anatomically, it's fairly easy to, kind of negotiate. And, a lot of the surgeons think that this is a very difficult area to actually liposuction because there's a lot of anatomy there. I'm trying to figure out the pointer if that's backwards. How do you guys do the point? Can you do the laser thing to show the anatomy, Joel?
Yes, it's not on there, it's on the big thing, the round thing next to it.
The round thing next to it. This thing?
Well, it's this thing.
Okay. Thanks. So essentially, this area in here, there's a lot of lymph nodes. There's obviously breast tissue and breast fat, which is different from the more sort of normal fat that's around the breast tissue, and that's where you really want to be when you're injecting Kybella. And you have to be very careful to not get into this area. And that's why with surgeons, it's not so popular to really liposuction too aggressively in this area. And so it's been an unmet need. And that's kind of why I've sort of taken it upon myself in 2016 to try and figure out a good protocol to do this and take care of this area in a lot of people. If you look at Hollywood, if you look at even sort of trends, the trend of the first picture is 2006 Sports Illustrated. You can see big breasts for men. 2016, not so much. And so, a lot of women are actually getting their implants either taken down or taken out, and a lot of them are actually, afterwards kind of focusing on this area, as a problem area. And again, like I said, even to people who are thin in Hollywood, you can see here, Claire Danes, great shape, but she's got this little thing, and the dresses that are, hip for Hollywood and hip for formal parties and stuff, always have this. America Ferrera lost a lot of weight, but she still has this little part right here. Even Regina King, who has amazing arms and who's in great shape, has a little bit of this right here, and it seems to be a problem even for women that are in excellent shape. Everybody, I think, has it to some degree, so I've been trying to work out a protocol for Kybella to do it. Just because you can get a really nice fine-tuning with Kybella. One thing about Kybella, I'm noticing with most products and most lasers, I find that the FDA trials kind of have people overuse the drug and in one sense perhaps used to sell more drug, but also in another sense just to get really good results. I feel with Kybella, you kind of need to use more. You need to extrapolate more than the next studies show. And so I'm using quite a lot now, probably more. These pictures were probably taken in the spring or summer. I would probably use twice as much now on this patient. I'd probably use 8 cc's in one session. The FDA labeling says you need to use no more than 10 cc's in one session, but you can push it to that. I think the price marking, the upcharge on it probably wasn't as profitable as I first thought it might be, but I think that it still can be very profitable. What Allergan is recommending is we charge $600 a vial, so that's $600 for 2 cc's, and our cost is $300. So, you're still doing well, and I have an attention span canvas of 10 minutes. So, this is much quicker than even any of the laser procedures. I can knock this out in 2 minutes, and people tend to be very happy with the results afterward. I haven't had one patient that's really said, you need to do it again, or I don't like it, or I want my money back, or anything like that. I've probably done 20 patients now. This is a side view. And this is, again, I did a very small amount. This is probably right when I started doing Kybella in the bra line, so probably around this time last year. And that's you can see, it's hard to show you 3D pictures on a 2D screen, but you can see that that's a nice result. On the side, it's safe in darker skin. Here, I only did 1 cc. I would have probably done 3 or 4 cc's on this patient now. And also, it's safe in dark skin without hyperpigmentation or any issues like that. This is, so that just to change topics, I know a lot of people are showing this, but I just wanted to show you, I'm seeing a lot of nice bra line contouring with Ulthera too on the back. So here I'm showing one side where I did Ulthera on her, that's her persists, and people are happy with that. So if you're not finding a lot of fat on the back, but you're just finding this kind of sagging muscle and skin, I find that this is actually a very good bra line contouring procedure as well. I'm doing it a little bit in gynecomastia after the person has had MRIs and a full workup. This patient was happy. I'm not that happy with the result, and I'm not sure how much more I'll be doing it, but I just wanted to show you that guys have chest issues too. And then just basically I wanted to discuss these are sort of the discussion points and the problems I'm having with doing this procedure right now. The first is sort of calling this the bra line to me is somewhat feminizing. It's kind of like how we used to call, lasering the groin area, the bikini line in 1999. And to me that seems feminizing, and I think we need to think of other descriptors for these areas. So that's one thing I wanted to say, is I don't want to call it bra line, but I'd love to, I guess chest we could say, but that's not so, it's not so specific. The other thing is we had a heck of a time with standardized clothing and paper surgical clothing that they use for, breast lifts and all that. I found that the differences you're getting, these tend to be thin patients, and the differences you're getting when you use the surgical paper doesn't really show up because the breasts fall differently. What I've found is just getting them to wear the same bra again for their after pictures seems to be the best. But that's a hassle. My staff has to call them and remind them. And believe it or not, you'd be surprised how fast we all go through our bras. Half of them are like, well, I threw that one away, I used it for 3 months, it's stretched out, it's gone, So that's been a challenge for me in terms of treating this area. The other areas I showed you, you have to, really multiple areas included in this what we call the bra line, which I'm hoping we can change. It's the sides, it's the back, it's below the back of the bra line, it's above it, and then also the concept of the breast fat cells and not getting into that kind of fat and staying in the more superficial layers of the fat versus liposuction. And I have 18 seconds left.
Thank you.